Good morning, good afternoon. I'm presenting on behalf of my colleagues Anne Stankel and Triantafyllos Pliakas, who developed a revised framework envisioning social enablers in support of the global response to HIV. This is based also in a technical consultation which happened last year with a broad number of people of that technical working group. UNAIDS has developed since 2001 a revised set of programmatic targets and estimation of the resource needs since 2001 every 5 years. The current one, the last one, was developed in 2014 to inform the conversations around the Sustainable Development Goals and was updated by 2016. This type of process led to the promotion of the testing and treatment targets of 1990 by 2020, or prevention targets focused around 5 pillars of prevention with proven effectiveness and promotion of more than 90% coverage for selected programs and populations. It also provided inputs to the current UNAIDS global strategy, and it helped to adopt by the global community some commitments like the mobilization of 26 billion this year for low and middle income countries in the high-level meeting political declaration on ending AIDS in 2016. The next steps for the work I'm presenting is to support the process to update the 2025 programmatic targets and estimation of the impact and resource needs for the next decade. The focus in the presentation today is how to expand and define better the social enablers targets which in response to the HIV. We will be promoting the cross-cutting principles of a people-focused approach and inclusion and participation, in particular the community-led responses. The critical enablers to support the response to HIV could be grouped in social type, services related or systems related, while promoting the 2 principles mentioned above. We believe that by setting targets, we are supporting countries to mobilize financial, human, and institutional political resources and monitor progress in the achievement of a better social enabling environment to deliver services, with the goal of removing structural impediments for optimization of these programs, with the vision of getting the 3 C's and achievement of the social development goals. The programmatic strategies to achieve a social enabling environment has been grouped in 3. A society free of HIV-related stigma and discrimination, a supportive legal environment and access to justice, and promotion of gender equality. At the same time, we promote that we should strongly have synergic and simultaneous co-action in pursuing other social development goals. For example, promotion of education among young women and girls, reducing inequalities, but all of these are of equal importance. We believe that based on this co-action across development sectors, with the improvement of the system, service, and social enablers, we would have improvement of or optimization of the implementation of basic programs seeking HIV prevention, care treatment, or any other HIV-related program to achieve the subsequent vision of the 3 C's. The suggested targets were based on a targeted search and a technical consultation which was held in Switzerland last year, which linked different indicators with HIV outcomes. Among them, reduction of HIV incidence and improved medical outcomes, avoiding morbidity and mortality. The specific targets that we're suggesting in stigma discrimination is to reduce discriminatory attitudes among the general population and the experience of stigma and discrimination among key populations and by people living with HIV. At the same time, reducing the prevalence of internalized stigma of people living with HIV, and promotion of actions and programs which diminish discriminatory attitudes among duty bearers like health workers or law enforcement officers, teachers. We would believe that they will reach less than 25% by 2025 and less than 10% by 2030. With respect to gender equality, we would need to promote actions and programs so that less than 10% of women and girls experience intimate partner violence by 2030, and the same type of reduction for gender-based violence in sex workers, men who have sex with men, transgender individuals, and people who use drugs. We would like to see also a reduction on the people from the general population who support inequitable gender norms. And conversely, we would like to see that at least 95% of the HIV services are gender responsive by 2030. In legal environment, we would like to see a significant reduction of countries with punitive laws which criminalize sex work, possession of small amounts of drugs, same-sex behavior, or HIV transmission, and an increase on availability of redressal mechanisms, increased access to legal services, an increase of the people who experience rights abuses who seek redressal. In conclusion, these social enablers will allow us to improve our the achievement of program targets by removing social impediments to have optimized program effectiveness, which will be the norm in the next decade. The results of this work will inform the UN's global strategy and the next possible political declaration of commitment expected next year.